First aid is crucial. It can save lives. Knowing what to do in an emergency can make all the difference. Every second counts. You can be a hero with basic first aid skills. First aid is not just about treating injuries. It's about providing comfort and reassurance. You become a beacon of hope in a crisis. Your actions can calm and reassure someone in distress. Learning first aid is empowering. It gives you confidence in challenging situations. It allows you to take charge and help those in need. First aid is a valuable skill for everyone. Choking is a serious emergency. It happens when the airway is blocked. Quick action is vital. Look for signs of choking. Is the person unable to speak or cough? Are they struggling to breathe? Is their face turning blue? These are all signs of choking. If someone is choking, call for help immediately. Then, perform the Heimlich maneuver. Stand behind the person and wrap your arms around their waist. Make a fist with one hand. Place it above their navel, below the ribcage. Grasp your fist with your other hand. Give quick, upward thrusts into their abdomen. Continue until the object is dislodged. CPR stands for cardiopulmonary resuscitation. It's a life-saving technique. Use it when someone's heart has stopped. First, check for breathing. If there's no breath, call emergency services. Then, start chest compressions. Place your hands on the center of their chest. Push down hard and fast. Compress the chest at least 2 inches deep. Give 2 breaths after every 30 compressions. Continue CPR until help arrives. Remember, every second counts. Remember, every. Section 4. Severe bleeding. Controlling the flow. Severe bleeding requires immediate action. Control the bleeding to prevent blood loss. First, protect yourself. Wear gloves if possible. Apply direct pressure to the wound. Use a clean cloth or sterile dressing. Elevate the injured limb above their heart. This slows down the bleeding. Maintain pressure until help arrives. Don't remove the dressing. Section 5. Burns. First steps for soothing the pain. Burns are common injuries. They can be caused by heat, chemicals, or electricity. First-degree burns are mild. Second-degree burns are more serious. Third-degree burns are the most severe. Cool the burn immediately. Use cool running water for at least 10 minutes. Don't use ice. It can damage the skin. Remove any clothing or jewelry near the burn. Cover the burn loosely with a sterile dressing. Don't apply any ointments or creams. Seek medical attention for severe burns. Section 6. Sprains and strains. The RICE method. Sprains and strains are common injuries. They affect muscles and ligaments. The RICE method is effective for treatment. RICE stands for rest, ice, compression, and elevation. Follow these steps for pain relief and faster healing. Rest the injured area. Avoid any activities that cause pain. Ice the injury for 20 minutes at a time, every 2 to 3 hours. Apply compression with a bandage. This reduces swelling. Elevate the injured area above the heart. Remember, these are just basic guidelines. Always seek professional medical advice for any injury or emergency. First aid can bridge the gap until help arrives.